I wore the sweatshirt last time I made an educational TikTok. Maybe it'll become a theme. I don't know. Also, you like my red lights overhead? I was kind of feeling it. It's holiday vibe, you know what I mean? Hello, my name is Noelle. I am a paramedic, and I want to help you not need me. Let's talk about allergic reactions and anaphylaxis. A lot of people get these two terms mixed up. A lot of people don't know what the difference is between the two. Basically, all anaphylaxis is an allergic reaction, but not all allergic reactions are anaphylaxis. Let's talk a little bit about the pathophysiology of allergic reactions. First thing that has to happen is you come into contact with some kind of a substance, either via skin contact, ingestion, injection, or inhalation. This has to be a substance that does not pose any threat to the body whatsoever. It cannot possibly be harmful to anyone. But for some reason that science doesn't quite understand, the body sees it as a threat and goes into attack mode. Without going into the nitty-gritty details of all the immune system does to make this happen, basically it releases histamine, which is what causes all of the symptoms of an allergic reaction and anaphylaxis. The main thing that differentiates anaphylaxis from a normal allergic reaction is anaphylaxis, by definition, has to involve at least two body systems. So the body systems that are typically involved in an allergic reaction would be the skin, the respiratory system, the cardiovascular system, and the GI system. If it's anaphylaxis, it has to involve at least two of those systems. A regular allergic reaction would only involve one of those systems, and generally speaking, these are going to be mild to moderate symptoms. Examples may include if you touch a plant that you're allergic to and get a rash on the general area where the plant touched, if you eat something that you're allergic to but you don't go into full-blown, puffy face mode over it, like if you just get an itchy throat. When we're talking treatment for these very simple, non-life-threatening reactions, we're just gonna go with Benadryl, if anything. Some people just kind of let it ride and just let it run its course and go away on its own. But you can take oral Benadryl. We might give IV Benadryl depending on how bad it is. Topical Benadryl for if it's like a topical reaction. In rare cases, an allergic reaction can involve only one body system but still be severe enough to be considered to be life-threatening, in which case we would give epi for that. More on that later. Anaphylaxis. Again, it's going to involve at least two body systems, and it's pretty much always going to be way more severe than a typical allergic reaction. Signs and symptoms include, but are not limited to, swelling in the face and tongue, airway swelling, wheezing, rapid heart rate, low blood pressure, high blood pressure, generalized hive swelling, nausea, vomiting, etc., etc., etc. It's a mess. There's two basic things that make anaphylaxis deadly, and that's airway swelling and low blood pressure. Airway swelling is pretty obvious why that's life-threatening. If it gets too swollen, it can actually close up on itself, and the patient won't be able to breathe. We wouldn't be able to put an airway down there. The only way we would be able to get an airway in this case is a procedure called a cricothyrotomy, which is basically we're gonna surgically insert a little tube into right about here in your neck. Yeah, not fun. With low blood pressure, the reason why that happens is because histamine, the chemical responsible for the allergic reaction, causes your blood vessels to dilate, so they get wider, which causes the relative fluid volume to decrease. So the amount of fluid may be the same, but with the vessels being bigger, it's going to seem like there's less. Histamine also makes your blood vessels more permeable, which means it's easier for fluid to leak out of the vascular space and into the tissues. That's what causes the swelling, and it can also further decrease the amount of fluid available for circulation. This causes a drop in blood pressure, and to compensate for this, your heart is going to beat a lot faster. When this happens, we call it anaphylactic shock. So shock is just a general term for when you're just not perfusing enough blood all through your body. Anaphylactic shock is shock caused by anaphylaxis. The first-line medication that we give for anaphylaxis, whether or not we have shock in the body, is epinephrine, epi. It's important to note here that epi does not reverse the allergic reaction itself. It reverses the life-threatening effects of the allergic reaction. Epi reverses shock by narrowing those blood vessels and increasing your blood pressure, and it also opens up those airways so that you can breathe better. Many patients with a history of anaphylaxis, or if they've been allergy tested and are identified as at risk for having anaphylaxis, will carry around an EpiPen, which is an auto-injector of epi that they usually put into their thigh. The effects of epi only last about 5 to 10 minutes in the human body, so that's why EpiPens usually come in too. So that way, if you need a second dose before the ambulance gets there, you can give yourself a second dose. An ambulance with a paramedic staffed on it will also carry epi for allergic reactions, and we will also give this into the muscle, usually in the shoulder instead of the thigh. And we can give this as many times as is necessary to reverse any life-threatening signs and symptoms. Other meds we can give in the event of anaphylaxis, Benadryl, because that's going to be your reversal agent for the allergic reaction. Because the epi, again, reverses the life-threatening impacts. Benadryl is going to actually stop the process that is causing the reaction in the first place. If your blood pressure is low, we can give you some IV fluids to put some fluid back into your vascular space. If you're having wheezing, difficulty breathing, we can give you a nebulizer treatment. Some services carry, like IV Pepsid, IV Tagamet. Not mine. I wish. We also often give a drug called Solumedrol, which is a steroid. It reverses inflammation. For very severe wheezing that's not responding to traditional breathing treatments, we can give IV magnesium, which will open up those lower airways more. That's just to name a few. You may or may not get all of these, or some that I didn't mention. It's all on a case-by-case basis. It's all about how the patient is presenting. If you're having an allergic reaction and you're not sure if it's going to become life-threatening or not, it's best to just go seek medical care, because if you have to ask yourself if it's really bad, it might be pretty bad. But yeah, hope that helps. Hope you learned something. See ya.